Okay, so again, thank you for joining the Unequal Neighborhoods website reveal and webinar. Uh, we say your zip code matters because where you live impacts how you live. Uh, Before we get started, I want to also give an opportunity for our partners building healthy communities to give you a welcome as well. And so
Good morning, everybody. This is Augie here at Fresno Building Healthy Communities. Thanks everybody for taking part. We'll be on this webinar. So in the room, I have Sandra Celadon, who actually just stepped out, but will be back in a few minutes. Myself, Augie Blancas, I'm the Communications Director for Fresno Building Healthy Communities, and Kimberly McCoy, the Project Director for Fresno Building Healthy Communities.
Great, thank you. And we also want to thank our funder, the California Endowment, for helping us see this vision through that we had about how to frame how neighborhoods are created. So we want to thank them as well. So in terms of what we're trying to do here today is really give you a sense of how we have tried to answer these questions of how do neighborhoods get created to look the way that they do. When you drive as part of your daily drive from one part of town to another as you head to work, what is it about policies and really traces of the times of legal segregation that remain that make it so that neighborhoods look different? We also want to emphasize that there have been so many things done in Fresno policy-wise that have been for the purpose of progress. And we want to be able to analyze these policies that were made in that name and really analyze the consequences. What were they intentional or unintentional consequences of progress in some areas, and did they lead to neglect in other places in the same city? And also, which is the most important piece for us, is that if inequality in neighborhoods is created, how can it be reversed? And what are policies and measures that can be taken so that the same mistakes perhaps that were made in the past aren't the ones that guide our future? So for those of you joining us from other places, aside from Fresno, I want to give you a sense of really kind of where we're at in terms of California. So as you can see in the map to the right, we are part of the Fresno County, central part of California. And within that, the city of Fresno really lives kind of in the middle of that county to the north part of the boundaries. We want to, before we get started on all the research that we've done, I want to introduce you to how this work came along. We started this work in 2016 as part of our learning and evaluation work that we do for Fresno Building Healthy Communities. Fresno Building Healthy Communities is one of 14 sites throughout California that works towards building health equity. And we really wanted to do a piece of work that reflected teasing out what is it about neighborhoods that we can really study from a policy perspective that can help guide how to make decisions about neighborhood equity. So our research team, as you can see, is comprised of mainly mostly women of color, myself as the principal investigator of this study, our staff, Karina and Guadalupe Corona, Stephanie Chan, Amanda Conley, and Hanita Dillon. So what are unequal neighborhoods, and why did we choose this name? We wanted to bring about the idea of combating the myth that Fresno is somehow just bad for everybody. So Fresno really is ranked among the poorest in many regards, and many have perceived this to be the overall plague of all of the city, that we all suffer with low air quality, green space, a little green space, poor health, low education, and poverty. However, we wanted to note that there are policies and exceptions to policies that have created neighborhood situations in the way that they have since the inception of Fresno, and that actually not everyone has experienced or is currently experiencing some of these poor outcomes. So what we have now is that this effect of that while some neighborhoods experience neglect, other neighborhoods had opportunities created for them through forward-thinking vision and policies. However, these policies were creating inequality in Fresno. And even at the time that they were being created, they were opposed by many groups of concerned citizens. This pattern over time of creating opportunity for some and neglect for others created a multifaceted situation, opportunity in some neighborhoods, while furthering the gap between the poor and the upper middle class in Fresno. So the concept of unequal neighborhoods is really a framework that sees Fresno beyond one data point. Rather, Fresno is a sum of consequences of policies and exceptions to policies that shaped the city to have some neighborhoods sharing outcomes with some of the best places to live in California, and others that are among the most dangerous, unhealthy, and polluted. And so I wanted to share the population characteristics of using the CalEnviro screen here to the right, that really shows that in terms of asthma, poverty, education, you can see that the census tracts in Fresno that are among the darkest are among those with the poorest outcomes, and yet we have some of the lightest shades available in terms of how we rank census tracts as part of the larger California part of California. To note that in some places we are actually way below average and have really great outcomes in these areas. So if there is inequality and there are unequal neighborhoods, there are some that, like I said, have benefited over time. And we wanted to look at and study what are some of those neighborhoods and what are the characteristics that shape these neighborhoods. And so we outlined a group of census tracts in Fresno that we call the advantaged neighborhoods. And as you'll see through our policy timeline and some of the outcomes work that we'll share with you, policies were passed over decades to make these neighborhoods desirable and have plenty of amenities and healthy places around them. And they were actually a draw for further suburban and sprawl. One of the key things to remember about these types of census tracts, and really Fresno as a place, and it's important to look at to see if other cities share this, is that Fresno has a lot of unincorporated census tracts, so county islands throughout, and the advantaged neighborhoods, some of these census tracts, some of these places are also unincorporated places, within the city of Fresno limits. However, even if they are not part of the city, they have benefited from what has been created around the boundaries for them in terms of these assets that I mentioned. And so when we see these boundaries, we know that they are not perfect boundaries of the most advantaged neighborhoods in Fresno. But when we combine community assets, the demographics, income, and education, as well as environmental safety, low industrial impact, it is these neighborhoods that stand out to us. So if those are the neighborhoods that have benefited, which ones are the ones that historically have not? We decided to use the Building Healthy Communities, the PLACE region, or the BHC PLACE. And this includes what we would call kind of South and Central Fresno. It is an area that it faces all of the things that you may read about Fresno in the paper or see on television or study about at school. It's the place where you are seeing challenges of poverty, unemployment, negative health outcomes. And as such, the California Endowment decided to really try to invest in this area as an area for health improvement. And so while some areas, as I said, like advantaged neighborhoods, had some of the best outcomes in California, we actually see within the same city limits some of the poorest outcomes in this in our state as well. So one of the first pieces that we created as part of this, trying to analyze what happens when you have neighborhoods that look so different and how can you trace back what has happened. We decided to embark on a project where we did a lot of archival research since 1872 to really see what are the times in history and the actions in history that help shape Fresno to be what it is today. So this timeline isn't meant to be exhaustive, but representative of how actions fueled consequences of how Fresno was shaped to look what it does today. And so I want to be able to share with you this timeline. And so we will have all of the links available for you in terms of how to access this content online. But I want to share with you a little bit about what we found. So Fresno, as many of you may know, was really founded around the idea that the railroad was going to be the central focus of why a city would exist here. Obviously, then farming became a really big part of this as well, but it really began with the railroad. And when Fresno was, if I could remind you to mute yourselves if you are not, thank you. Fresno was really a colony that was first established in what we would call the south part of Fresno now. Even when people began to settle in Fresno, there was segregation that happened. And people were, as they were brought here to work on the railroad or to work in other areas of the economy, it was very clear that they were put in one part of Fresno over the other. We think that this piece of Fresno history has been documented very well throughout other research projects. But it's important to note that historically, people were put in certain quarters of the city and were dissuaded, or through legal policies were not allowed in certain parts of Fresno. And this really shaped how other people saw the experience. So, for example, this Harper's Bazaar piece on Fresno notes, separated from the main part of Fresno is the Chinese Quarter. Its isolation tells the story of a peculiar people who tenant it, and of the feeling of social ostracism entertained to them on one hand, and their own unconquerable clannishness on the other. And so this piece, revealing even some of the racial sentiments towards Chinese immigrants at the time, also shows how isolation was happening, and it was actually embedded in policies and embedded in how people rented out spaces, or people could buy property or not. One of the things that we saw is, because there was this divide to put people more to the less desirable social groups and races and ethnicities towards the south western part of Fresno, is that even then, when it came to thinking about what resources were going to go there and where things were going to, the undesirable assets that any city needed to have, it was clear that the undesirable assets were going to be in the southwest of Fresno. And so while the city of Fresno has gone through a long battle, for example, of a meat rendering plant and relocating it to a different part of the city that wasn't so close to residents, we can see that this type of practice of putting undesirable assets in that part of town has begun long before even the thought of a meat rendering plant or some big factory. We also wanted to note that there were one of the major assets that we see that as cities having are access to healthcare, and not only access to healthcare in terms of clinics and having access to primary care physicians, but really hospitals as key places where people can get comprehensive care. And we found that within the history of Fresno, hospitals were really placed around what we would call the city center, the city core. And yet we began to see, even as early as the 1930s, that these boundaries began to be pushed more northward. As these places of commercial opportunity start, so does the need for more housing more northward. At the time when this was happening, segregation was legal, and definitely, as has been recorded elsewhere, there were systemic ways to shut people out of northward or more desirable housing. And people of color, and particularly African Americans and Chinese immigrants, were confined to only certain areas of the city. So when we think about, again, here is another example of how a landfill ended up in southwest Fresno. And at the same time all of this was going on, the city was developing northward, and making these assets be built in the southwest of town was deterring city development in that area. And so here's some of the history of the meat rendering plant that I was mentioning earlier, and how it really came as an exception to a policy. So it's not that always that policies were created in nefarious ways to target poor communities or communities of color, that sometimes it was the exception or granting special permits or rezoning of places. And so we see that again when we see the building of Manchester Center, which was 3 miles north of the city core at the time, and which even at the time people felt like there would be some concern about driving business away from the city core. I want to note here that in 1958, the General and College Community Plan is adopted, and that this was a piece of policy that was passed with the idea of, we're seeing that the growth is getting away from us, from the city core, and so we want to draw it back to the downtown area. We want to draw development back to the downtown area. However, throughout the years, there was lots of interest in continuing to build outside of that core, and developers and really pushed through campaigns to sway, at the time, city officials to really build outside of that plan. And so at the time, while there was that thought to have good policies that would keep growth in a contained area, there were always special interests trying to see how we could push the limits. And what we saw here in terms of Fashion Fair and the building of Fashion Fair, which drew the boundaries to Shaw Avenue, which is several miles down from the original city core, north of the city core, was that this approval to rezone land. This building of this mall is important because it extended the boundaries of where commercial growth was going to happen. And as commercial growth happens, so does housing, and the need to have housing there. And so really, at the time, this decision, which was seen as a way to bring this huge opportunity of having a big regional mall within our city boundaries, actually had the consequence of moving development, moving job opportunities, and moving really what was considered desirable parts of Fresno way out of the reach of the residents who had historically lived in South Fresno, both Southeast and Southwest Fresno. And so one of the things that we found that as part of this analyzing of the timeline and analyzing of the timeline of Fresno is that there were things that were done to try to mitigate some of the segregation that was happening. However, as these things were happening, there was also a need to have more resources allocated to this place where the sprawl was happening. And that's one of the things that all cities face even today. And this is why we think it's so important to learn our history, that when you spend money as a city, as a community, to invest in new places, you have to think about how that will impact the neighborhoods that are already in existence. And so And also, what is that effect in terms of racial segregation? When we saw that the fashion fair was finally developed, we also saw that that the city is faced with the question of how do we spend the money that has been allocated historically to people that are that have been segregated at a time when we also need these resources elsewhere. And what we saw at the end is that the city, which was the mayor at the time, wanted to reorient those funds to benefit all parts of Fresno. Sometimes we see these initiatives where people want to allocate money that was meant towards disadvantaged places in or disadvantaged neighborhoods within their city limits to benefit all people in the city. But what we saw throughout the effects of the shutting down of model cities is that at the end of the day, those are the places that need the heavier investment and the more concentrated investment. And when that doesn't happen, when you look to benefit some by benefiting all, other people have already been so left behind. And so, for example, when the city sought to reorient the money for model cities, West Fresno had already had over 100 years of segregation and neglect. And so to be able to catch up to the rest of the city that was being invested in, places like where Fashion Fair was being built, where this northern barrier was, where all this new economic activity was happening, they were never going to catch up without specific intervention. One of the things that we noticed in terms of healthcare is that as resources were, like economic growth was being moved northward, so were exceptions to rules or rezoning happening to move hospitals and medical assets to that new northern border as well. And we think that this had a huge impact because we think that this leaves people without a lot of options if medical services are moved away. Again, this is another example of rezoning requests being approved and moving economic opportunities northward. When one of our other major hospitals first came to the city, they came to that northward border. They didn't come to the city core. And the zoning of Herndon Avenue, which is even more north than where Fashion Fair was built, really what we began to see is white flight being accelerated. And when Kaiser also decides to move and have its assets, its hospital assets, be even northward of Shaw, back where the St. Agnes rezoning was approved, what you see then as the effect is that you had now two hospitals within a couple of miles of each other in the most northern border of the city, at the same time as one major hospital, which is what we have today, being left at the city core. We didn't know that at the time because there was still another hospital in Southeast Fresno, but that one then shut down and consolidated with the one hospital that we see today in the city core. So what does all of this show us in terms of the assets when they're moved over and over again? They are, it really has an effect on segregation. And so what we see in terms of the white population is that just in 15 years, we really saw that while they were already concentrated in the northern borders of the city, which were at the time like Shaw Avenue, they were further pushed out into that Herndon Avenue place, where we see these two hospitals, where we see the rezoning of commercial thoroughfare, and where we saw lots of new development and the city annexing new properties. And while this can be seen as a positive for Fresno, at the same time, there are effects that happen, and those effects are seen in the outcomes that we have, we are seeing today. And so what are some of those outcomes? Well, we want to show you that as a result, these neighborhood boundaries that I showed you earlier of advantaged neighborhoods, that now you can see how these are shaped, and that really northward sprawl focusing on Herndon as one of the boundaries of the advantaged neighborhoods. What we see today is a city that, while we think about it as homogeneous, as predominantly Latino, we see that that's really not the case if you look at individual neighborhoods. And that in those advantaged neighborhoods, we can see on average 55% of those people living there as being non-Hispanic white. Compared about when we think about the city as a whole as being predominantly Latino. And at the same time, where we see that racial diversity that really is more of what we think about when we think about Fresno, that's really the south part of Fresno. We still see even today that southwest Fresno, there we have the largest concentration of non-Hispanic Black residents, also pointing towards legacies of old segregation policies, particularly when you see compared to the 2.8% that exists of that same population in advantaged neighborhoods. In terms of housing, and this is one of the, going back to our beginning questions that we wanted to answer, does having this level of segregation affect us all, right? And what we found was that it really does, that when we think about who is spending a lot of money on housing, more money than they should, we see that the rates are pretty high for all people living in all of the neighborhoods. And so even those living in advantaged neighborhoods, while they own more of their homes, and while they're spending less than 30% of their income on housing, that still means that 40% of those people living in those neighborhoods are living really beyond their means, and they're paying the price tag of living in that place because it has all of these assets, but really living with insecurity that about will they be able to afford their home if there was a major event happening in their life, like loss of job or death of one of the income earners. However, even here we see wide disparities between the advantaged neighborhoods and these other neighborhoods. We chose to, when doing these comparisons of, well, what are the effects of all of these policies that happened throughout Fresno's history, we chose to focus on the place and advantaged neighborhoods, but we also took out Southwest Fresno as a specific neighborhood region because we wanted to point out that throughout time there were specific policies targeted at this part of the city, and continue to be targeted today, sometimes in positive ways, that really make this neighborhood unique. When we see access to transportation, we see a disparity in the neighborhoods as well. And here's part of another one of those, how this type of having unequal neighborhoods affects us all, is that those in advantaged neighborhoods get to have a closer commute, but there are still people who have to travel long distances for work. And this comes at a price for all of us, because as people have to travel further out to their jobs, they also have to get in their vehicles more. They have to therefore contribute to the pollution that we're already plagued with here in Fresno. And one of the things that we want to show in terms of how these neighborhoods are created and really combat some of these things about neighborhoods being shaped based on people's individual behavior or their own willingness to neglect, is that in Fresno, there's a really big desire by the residents to work. However, what people get paid is very different. And this stark comparison may also be connected to the racial disparities that we see, and also, but really tracing back to the opportunities people have, the education people are able to get. We're not going to show this, but we'll talk about it as part of our website. We see how, depending on where your neighborhood is, you may graduate being eligible for to enter into a CSU or a UC or not, just solely based on where you're living. So people are really getting different education, different opportunities, that is having this outcome of what can people actually afford, and what can people afford in terms of opportunities for their families as well. Even job growth and the opportunities for more employment within the neighborhood boundaries is different. And as you saw from my example of the many rezonings for commercial thoroughfares in the north boundaries, it's not a surprise that the advantaged neighborhoods would continue to see a rise in job growth while others see a decrease. And one of the things that shocks people about this lack of job growth, even within places like Southwest Fresno, is that Southwest Fresno is part of the what we call industrial part of the city, and so many jobs exist in that area. However, if you'll see to the graphic to the right of the job growth, this loop indicates how many people actually work and live in that area, which is and this data is by zip code, so it's a little bit different than the boundaries we have for Southwest Fresno, but it's the most populated part of this zip code. We have 1,600 people roughly who actually live and work in that area, compared to 16,700 who actually come in to work in that area. And so while there are definitely jobs in the area, they are not going towards the residents that live there. And this is an important thing to remember throughout the BHC place and those boundaries that we have, that very much is part of the ethos about who can live and work in the same place, and how that is a consequence of how cities have been shaped. So health-wise, we wanted to show you, we have many other indicators, but we wanted to show you this idea of years of life lost. And the idea here is, how many years do people die prematurely based on gender and life expectancy? And when we see gaps so great as these, that you can have 27 years of life lost versus 54 years of life lost, you're really seeing an entire community who is not going to see each other age, and that has really huge effects on people. And so while we see these places as younger and being full of young people, while that is a wonderful thing in terms of opportunities, it also speaks to the fact that older people living in that neighborhood do not have the same chance of living as long as other people living in other neighborhoods. And this really has a ripple effect on families and their communities. Thinking again about health, because this area that we showed you earlier, that Southwest Fresno, as having some of the heavy industry originally going there, we see that even the air that we breathe that isn't equal, and that can have effects in terms of who gets sick, right? And so as we see areas that are more polluted, we also see more emergency department visits due to respiratory illnesses. One of the things that we wanted to highlight in terms of thinking about how Fresno is not homogeneous is really this idea of, how is it that even our air is unequal? How does that happen? And one of the ways that we found is that green space and having access to green space, and particularly trees, can help mitigate the impacts of the things that we're all exposed to on a daily basis. And so while Fresno is seen as this part of this bowl where all of the pollution comes in, what we found is that trees can have this effect of helping mitigate some of that. And this is part of the EPA's Enviro Atlas work. And what we found was that there is significantly less tree removal of these harmful things in our air than in advantaged neighborhoods. So what we see then is that the place is significantly more likely to be burned with pollution, with these types of pollutions, and no way to really mitigate what the exposure to those. And those aren't, it's not only about the things in the air, but it's the things in the ground. It's the cars driving by, and all of these things, without tree buffers, without tree cover, without large spaces where people can go to enjoy some of that that air that's being filtered out by these trees, we see that the health effects are many. And one of the things that we found is that deaths from endocrine and nutrition related diseases were some of the most correlated ones in terms of the health effects. Now, why is this important? Because when we think about the health effects of pollution in our environment, in Fresno. We think about as everybody having asthma, everybody being exposed to things that will impact their respiratory conditions. However, we're not really investigating yet how other things that we may attribute to personal behavior, like diabetes or unmanaged diabetes, how those can also be affected by things like pollution, and how those can be a consequence of neighborhood characteristics rather than individual behavior. And so this is something that we hope to partner up with some of you all who are watching this webinar, and to engage with other people about this conversation, that some of the ways in which we've thought about things in Fresno, like obesity, diabetes, may actually be very much related to the built environment rather than individual behavior, and that attacking it from both fronts, from helping people learning how to eat better or have access to places to exercise, will be just as it'll be just as important to focus on, do they have enough green space? Do they have enough places where they are not being impacted by this pollution that we don't really think about as impacting that part of their health? So part of what we've learned is that policies and exceptions to policies have consequences that can shape neighborhoods for decades to come. And so the shaping of neighborhoods due to legal segregation, once legal segregation became outlawed, we see that policies can have these consequences where these neighborhoods continue to look very segregated. And even policies can be enacted so that the segregation even gets worse, as we saw with the white population from 2000 to 2015, get more and more concentrated northward. The consequences of policies are at all levels. They're at the social, economic, environmental, and health. It's so important to recognize that some neighborhoods, even with all the challenges that a city like Fresno faces, are actually thriving. And that's a result of investment and policies, and not individual behavior of just some people in Fresno wanting to get ahead more than others. What we've also learned, and what I'll talk about next, and actually turn it back to my Building Healthy Communities partners, is that when people come together to build equity, change in policies can actually happen. And so the last part of our timeline is filled with examples of how people have come together and really begin to shift the attention that's given to these neighborhoods that we saw as historically neglected, in terms of economic opportunity, pollution burden, education, and a number of other factors. So where we hope to go from here is to refine and expand our models to build the evidence of the effect of the neighborhood inequality. So while these census tracts we could see differences in, we could see correlations, really to build a robust model, we will need to expand it to other places in California and build out a larger data set to see how these patterns operate. We hope, and we're looking forward to working with young people to build the content out of the unequal neighborhoods that makes sense to them, because they are such a huge part of learning from our past to guide our future. We're also going to be doing on our website some guides for different populations to use the data and to think about how to even access some of this information on their own. As a whole, and as people both living in Fresno or in Fresno County or in other places around the country, we hope that we've convinced you that learning from our history is so important to help guide our future, and learning specifically about what are going to be the long-term consequences of a policy action, and noting the ruler of, will this build equity or will it build further inequity? So I want to hand it back over to Building Healthy Communities to talk about a little bit about some of the wins that they've had over the past couple of years, working in partnership with residents and neighborhoods and policy and decision makers to bring about policies that reverse some of these things that we've talked about today. Augie, I will bring it back to you. So, Augie?
Hi, can you hear me?
Yes.
Okay, we are having some major internet issues in our boardroom, so if I get cut off, I apologize in advance. So just going back, you just want us to kind of briefly cover the big wins that's listed?
Yes.
Okay, yeah. The Parks Master Plan was really brought forth from the work that we did when we were advocating for a more equitable general plan. The Parks Master Plan and the advocacy around the Parks Master Plan really came from the mouths of young people, why we weren't focusing on parks and why, some of the parks in South Fresno are in poor conditions rather than, the North Fresno parks, which are, vibrant and have the amenity, different amenities like open bathrooms, playgrounds, and, parks being properly maintained. So that kicked off when we received when we saw the general plan and we saw the disparity in the park section that between north and south. There's about 1.4 acres for every 1,000 residents in South Fresno, as opposed to 4.02 in north for every 1,000 residents. So the Parks Master Plan, when it was adopted, does lay the groundwork, but it does lay the groundwork for future investments for parks, but also again highlights the disparity that a majority of the parks in South Fresno are in poor or fair condition, which is a majority of them, and a majority of Fresnons lack access to a park within walking distance. So albeit that the fact that they updated the Parks Master Plan after 30 years is a success that they actually did update it. Again, still highlights the disparity and that more work needs to be done and more investment needs to be brought forth for parks. I will skip over the Southwest Pacific Plan and I'll hand that over to Kimberly McCoy in a minute. As far as the Transform Climate Communities program, this was a very, this process brought $70 million to Southwest Fresno, Chinatown, and downtown. But the majority of these projects will really impact the health of the community members, bringing forth more parks and walking trails, bike trails, basic infrastructure needs will be brought forth. And when I know that the city of Fresno right now is in a pre-contracting phase, but hopefully when the funds are dispersed, we'll be able to see real community change within a handful of years once the projects are implemented and actually start from the ground up.
Thank you. Thank you.
And then changing the narrative about equity. I mean, that's really our role. Our role as far, really our communications arm has really been around shifting the way people talk about health. Where, as you said in the beginning, the health just doesn't happen in the doctor's office. It actually happens where you live, work, and play. And so community members don't have the basic infrastructure or the basic things that they need, access to a grocery store, access to healthy and nutritious foods, the ability to go to a park and be physically active. We've really elevated the story that health is more than just the doctor's office. How are we keeping the community healthy?
Great, thank you.
Do you want me to hand this off to Kim and continue with the Southwest Pacific Plan?
Sure.
Okay, perfect.
Hi, Kimberly McCoy here, Project Director for Building Healthy Communities. With the Southwest Pacific Plan, this plan was developed to bring more single-family homes, more big businesses, no more industrial sites. So with this plan, we were able to get people to agree that industrial sites were bad neighbors. So that's where that was really, really a big win for us. We were really, really fighting hard to have them to recognize that industrial sites were bad neighbors. With this plan, it also brought in big businesses and more single family homes. Residents stated that they were tired of being on top of each other and they wanted more single family homes. They wanted more big businesses. They wanted a college. They wanted more training for jobs, and they wanted the jobs that we're going to be working on in West Fresno to go to the people who were living in West Fresno. So this was a really, really big win for Southwest Fresno. And now we're in the implementation stages of making sure that this plan is implemented right and that it's going to bring in everything that the residents said that they wanted to bring in.
Great. Thank you, Kimberly. Yes. And the Neighborhood Wellness Teams is a partnership between St. Agnes Hospital and Fresno Building Healthy Communities to try to bring much needed care into particularly two neighborhoods in Southeast Fresno. And so that is a pilot program that is in design right now, as well as many initiatives to expand and pilot and then expand restorative justice in schools, so that there is, instead of a school to prison pipeline, that we can create opportunities for young people and give them second chances. And so we told you that there's a lot of other content that we have on our website, cvhpi.org, and I want to show you that in terms of where to access it. So if you visit our website, cvhpi.org, you will see our home screen, and you can go to our programs and click on Unequal Neighborhoods Fresno. And there you will be able to access the link to our timeline that we covered, and see all of the entries that we have on there. And you can see some of the explanations that we gave in this presentation here, such as why we chose the boundaries of the place and Southwest Fresno, advantaged neighborhoods. You'll also be able to see demographics, health and inequalities, more information about the environment, health and place, education, which we didn't cover, and civics as well. So we hope that you'll visit it. And when after today, you will also see the copy of the webinar on here as well. And so we want to give you an opportunity to ask us any questions. But before we do want to give special thanks to EPA for helping us and training us on their tool on environment and how it impacts communities. And thank you for investing in Fresno as being one of the communities that you chose to have these more in-depth indicators on. Amber Constantino, who helped us with some of our analysis on health as well. And our executive director, who really helped in supporting us to do this research. And wanted to emphasize that we'll continue to build out the content of this research with building health communities with young people as well. And so if there's any questions, if you can enter them into the chat box, we'll have that open and answer any questions that you have at this time. We also have our contact information so that you can contact us for more questions and comments and collaborations. Please feel free to reach out to us as well. If you find it easier to unmute yourself and ask a question or a comment, now would be the time to do so as well. Okay, well, thank you very much for joining our webinar today, and we hope you learned a little bit more about the original questions that we set out to answer for you all. And we do have one question about to whom the webinar has been shown. So we have participants from Fresno, from the county governments, from other counties. We also have some participants from state, the California Department of Public Health, other academic institutions other than Fresno State, and EPA itself as well. And like I said, the webinar will be on our website. Somebody asked about, could you tell us more about the work that's been done on health inequities in Fresno? I think one of, in terms of specifically the asthma admission study. So one of the pieces of research that's being conducted right now, and some of our Central Valley Health Policy Institute investigators are part of that, is a children's health air pollution study, and that's one of the ones that's trying to answer the question: what are the actual physiological pathways, and what are the effects of pollution on our children? And so that's ongoing right now, and we hope to see some very exciting findings to be coming out of that. And I believe the preliminary findings are already showing that that there are some physiological changes that happen to the structures of the body structures when being exposed to pollution at the rate that some children in our region are. Another question was, how will monitoring of some of these most recently adopted policies be carried out, like the Parks Plan, the Southwest, and the General Plan? And that's really a key question about all of these policies. I think that my colleagues over at Building Healthy Communities would tell you that it's about mobilizing people, community residents, making sure that they're educated on the latest things that are happening in those on those policies, and giving them access to spaces like city council meetings and meetings with decision makers to make sure that those are moving forward and that they continue to be funded. And so I would say, from what I've seen as so far, this is the tactic that they've been using. The Parks Initiative, in terms of the November ballot, will that help alleviate the recreational space inequities? Or are they focused on developing parks specifically outside of advantaged neighborhoods areas? One of the key things that's going on with in Fresno right now is that there is now an approved ballot initiative for funding for parks. And this was developed with in partnership with Building Healthy Communities. And so this Parks Initiative, from my understanding, will help not only the creation of new parks, but helping update parks in neighborhoods like outside of the advantaged neighborhoods. And so it is really an initiative, from what I've seen of the text of some of the materials, that will benefit all parts of Fresno. another question, are you aware of researchers using the network of air quality monitors, including low-cost monitors, to look at disparities in air pollution exposure? So we're very much excited and about the new legislation around air monitoring. And while we don't know of any researchers that are using those particular air monitors, we do have partnerships with other people who have their own monitoring, particularly around preterm birth, and using things like smoke analysis from wildfires, that we hope to be doing some research in the very near future with that. Okay, and so thank you so much for your questions. And it's a one last question. Are there any resources that researchers can utilize to better understand the impact of zip code and pesticide concentration in Fresno? There definitely are some monitoring around pesticide, and if you actually send me an email, I'll go ahead and send you that link. But this is a resource within the EPA, part of the larger EPA's monitoring tools that they do have. Now, in terms of how the update or how live some of that is, I think it depends on the resources that are available to keep that. But I do know of at least one resource, so please do email me at tpacheco@CSU Fresno for that. Thank you so much, and we hope that you enjoyed our webinar and that you will stop by our website and see our resources, and more importantly, find use for them, both in your own work, in your own policy work, in your own academic work, and reach out to us for any questions or partnerships. Thank you so much.